There is a continued crisis at the U.S. borders, and when will we get it under control? Many people are saying that it is an invasion, and the Biden administration finally seems ready to put teeth into legislation to change the course on this issue that is becoming a albatross around his neck. And also, what is the latest with healthcare? Do you know when you're dying? You ever thought about that you could be dying and don't realize it? Do you really know when you're sick? We're going to delve into a lot of health issues tonight on this, Your Voice, Your Future. I'm Armstrong Williams. Let me welcome our guest to the broadcast, one of my favorite people on the planet, the editor of A&D magazine, which I read. Sam Faddis, welcome back to the broadcast. It's good to see you.
Thank you for having me, sir.
Yes, and Gunther Sanabria, I haven't seen you in a while, man. Immigration lawyer, you've been busy.
Yeah, I've been busy.
Tell us how your life has changed since the invasion of America by these migrants.
Well, I wouldn't call it an invasion.
Oh, I know you wouldn't, but that's what I call it. Oh, of course not. It's good business for you, right?
It's poor people that need our help.
Oh, they're not just poor people coming across the border. But tell us how your business has been enhanced as a result of this.
Well, we are defending these people. You know, we are taking them into this country. I'm an American citizen now. I was an immigrant once. And now we're going to court. There's asylum applications. They have increased. There's no denying there. But at the same time, this is a country of opportunity. This is a country that has, for many, many years in history, has been the home of freedom. And that's what we do.
Yeah, but they followed a process to get here, and they know what it was like to become an American citizen when they go through the process for 2 or 3 years. They were not able to storm the gates and just come in and no checkpoint, spread across the United States, not accounted for. It's a different citizenship.
Right,
Come
right.
on now, brother. Come on.
They're not storming the gates. They're coming.
You've not seen the footage?
Well, yes,
what are you watching?
The footage of the people dying at the border, trying to cross the river, putting, barbed wire.
They decided to come here.
Because they're escaping.
They decided to come here. It's not as if Americans are killing them. That's a decision they made.
It's kind of expecting the Ukrainian people not to make it to the United States.
We're not talking about Ukrainians. We're talking about the migrants that are crossing our borders. It's like an invasion.
They are people in need, yes. And they're coming to the border.
What about American people that have needs, that are being impacted by this in New York and Boston and all across the country? What about Americans? Seems like Americans are last now.
The Americans have better rights. The Americans have the opportunity to elect good leaders, to put good laws. The immigrants don't have that option.
No.
So the Americans actually should be doing that in this election. Select the right leader.
There are many
to put the
Americans
right laws.
feel that their way of life, their health care, their real estate, their housing, the benefits that they once had has been overtaken by millions of migrants that have come into this country.
I agree. And why are we blaming the migrants? We should be blaming the leaders, the politicians.
Why don't we blame the countries that they're coming from? Why can't the countries take care of their own like Americans should take care of theirs?
I agree with you.
I'm not going to blame the Americans. What about Venezuela? What about these other places where they're coming from?
Who in those countries?
Why don't you tell us? Why can't they provide a better life for their people?
Let's talk about the Venezuela.
Let me go to Sam Faddis. I'm going to come back to you.
Okay.
Sam Faddis, what is your perspective? Because you can tell I'm boiling hot about this issue because I hear it all the time, okay? America's upset about this. Is it misplaced, Sam?
No, Americans are furious about this, and they should be furious. Look, the policy of the Biden administration that they will not say out loud, but the de facto, the policy in reality, is we do not have a border anymore. We have open borders, and everything else is a charade. So we operate a conveyor belt of camps across Central America to move people to our border. The camps are actually run by the UN and NGOs, but the funding comes largely from the United States, and the lady who runs the UN outfit that oversees all this was effectively installed by the State Department. So we move these people here. When they come to the border now, they don't try to run from Border Patrol. They seek out Border Patrol and turn themselves in because they've all been briefed. They understand they'll be processed. They'll be given a notice for a hearing. This is a charade. The hearing is maybe 10 years in the future. Most of the people never show up and nobody goes looking for it. It is called by what I call illegals the permit. So, because once you get it, if you're stopped by law enforcement, your answer is, I have a pending court date, and then you can continue to reside in the United States until such time, really forever. Not only that, but then typically the U.S. government is paying contractors, NGOs, non-governmental organizations, to fly these people and move these people into the interior of the country. So what we have to understand is it's not like we're trying to control the border and we're failing. This administration is succeeding in its policy, and that is to bring in violation of U.S. law, millions and millions of people. And obviously Americans are furious. God, you see what's going on in places like Chicago, where with every justification in the world, you got the black residents of poor neighborhoods in that city saying, I'm sorry, what? I can't get city services. I can't get a job. I can't get you to do anything for me. You're handing this dude who broke our laws everything in the world. Or out where I live in rural Pennsylvania, where people in the dead of winter are walking to the dollar store to get groceries because that's the only place close enough to walk to, and they can't afford gas for their cars. And then you're telling me you got money to pump millions of people in violation of our laws here. So yes, Americans are mad as hell, and we're at the breaking point on this.
Your response?
I'm sorry, but it's not completely accurate, okay? I understand the fact that American citizens are fed up, are tired, but...
Infuriated.
Infuriated.
Angry.
I agree with you,
Disgusted.
100%. You know what? I'm angry too that taxes keep going up, the interest rates go up, but I don't blame the people selling their homes. I blame the government. I blame the leaders, okay? These are people running, and like your guest said, they run to the Border Patrol. Why? For help. These are people that are coming, for example, from Venezuela. There's a dictatorship. And what is the United States doing for that? Nothing, really.
Is it our problem?
They're restricting.
No. Is it our problem?
No, it's not.
America has its own problems she needs to take care of.
But I tell you, why is the government taking away the restrictions in the oil from Venezuela? There is an economic reason for politics, and that is the problem. The immigrants are not the problem. It's the leaders who see a benefit to make deals with a government like Venezuela. That is never going to help the immigrants coming to the border.
So you justified let them all just come in?
No,
you have
absolutely
no issue
not.
with it.
Okay,
where do you draw the line?
I'm an immigration attorney. I don't tell them, hey, you know what? Everybody comes in. I tell them, you need to qualify for asylum.
Where do you draw the line? You don't see this out of control?
During Bush, we had an opportunity
We're not talking about
to
Bush.
fix.
We're talking about now.
Obama,
do you see any area where this is out of control now?
It's not out of control. It has.
What planet have you been living on?
In America.
It's certainly not America.
In America, yes.
Oh, come on.
This is the problem. The leaders are conflicted in the new reform that has right now. Right now, we have a project for a reform in immigration. And what are the Republicans doing? Saying, don't sign that. Ted Cruz is saying, we don't need it. Donald Trump is saying,
maybe they don't like what's in it.
Well,
where you're going to at least allow 5,000 in every day. Well, maybe they don't like that legislation.
Because
maybe that's the issue.
And again, where is the legislation? In Congress. Why blame the immigrants when the leaders are the problem?
And what about them that violate our laws, violate women, have no respect for our rule of law?
That is an exaggeration because I can tell you.
What is it, an exaggeration?
In my offices, I have children, I have mothers, I have grandparents.
Okay, that may be correct, but that is not what happens in many other places across the country, whether you want to admit it or not.
No, but we don't hear about.
They commit criminal behavior.
There are criminals in every community. We have criminals coming from different parts of the country. They fly in with a visa. For why are we not blaming the embassies of those countries to say, well, why do you give a visa to a criminal? It's not the immigrants crossing the border the problem. Yes, there are criminals that come into the country, but that has nothing to do with those seeking asylum.
How many is enough?
Depends.
No, how many is enough?
I'm a lawyer. It's always going to be depends.
That's a business for you.
No.
It's a way of life for us.
To me, I was an immigrant.
It's a business.
I was an immigrant.
You're making money.
I'm giving free consultations.
You're getting
I'm working
paid
7 days a week.
for this.
Yes.
Yes.
You know why?
You don't have to tell me. I know.
Well, it's not always about the money. The politicians, it's always about the money. To us, the immigration attorney, we're overwhelmed with work because there are no immigration laws that protect the immigrants. There's no immigration system at the border that can filter the bad ones from the good ones.
Listen, it wouldn't be that problem if they could stay at home and take care of it. I think we need to take care of Americans. This is how Americans feel.
So barbed wire is the answer?
Whatever it takes.
Shooting them at the border is the answer?
I don't want anybody shot, but whatever it takes to slow this tide down. Let me go back to Sam. because I'm talking a little too much here. I'm showing too much of my feelings, how I really feel. So let me rein myself in. Sam, yes, go ahead.
Look, the line now from the left is that we want to solve the problem too, but we need new legislation to do that. I hear that all the time. That's a great line. It's a well thought out political response. It's completely, absolutely untrue. Donald Trump was in office. The law was the same law. The border was under control. What changed? What changed was that an administration came to office that does not believe we should have a border. They believe in absolute open immigration, migration. In fact, if you go to the Department of State website, everybody watching can do this, look at their webpage right there in broad daylight. What's their policy? The official policy of the American government now is safe and orderly migration. Not controlling the border, not keeping people out, not turning people away, making it as safe and effective and orderly as possible for people to move. Here's the other thing that's really troubling, Armstrong. I mean, not that I shouldn't say really troubling, everything's really troubling. The new cutting edge of the whole push on the left is to the term climate refugees, meaning that if you're impacted by climate change, you get to claim refugee status. And as we know, the line is that we are all impacted by climate change, and every country in the world is feeling its effects. Now, as a guy who did practice law for a while, you know, the real skeleton in the closet, as you know, if you add those principles together, that you can claim to be a climate refugee and everybody's impacted by climate, you got the ultimate card to play to say literally everybody on the planet can apply for refugee status in the United States. And that sounds like one of those things that if you told me like 5 years ago, I would have said, you're out of your cotton picking mind. But that's for real where we are today.
Now, what I'm going to do, in fairness to my guest, Gunther, I want to come back.
Well, I would like to clarify the law.
You are, brother. I'm going to take a break, and I'll come back, as I said I would. And we'll be back with both our guests. And we're back with Sam Faddis and Gunther Sanabria. You wanted to respond to Sam. Go ahead.
Yes, I just want to make a clarification. Number one, an asylum or a person looking for asylum doesn't take 10 years. They don't get lost. They get bracelets. They get regular weekly checkings. They have to send a picture. They have a GPS phone. People are being tracked until they go to court. And another thing, it's not everybody is entitled to come to the United States. If there is a natural disaster, if there's an earthquake, there's a hurricane, if this happened in Haiti, yes, we accept them, we help them. If there's a dictatorship in their country, they're getting killed, Cuba, Venezuela, yes, we help them. That's what we do. That is America. Historically, America has helped those who needed help. It's not that the borders are open. And the president right now has a project. Why are we not having more stricter immigration laws? Why not? Why doesn't the Republicans and the Democrats in Congress get together and say, you know what, we need immigration reform. We needed it in every election, this comes out. And then we spend 4 years doing nothing. Why?
Sam?
Your guest must be one hell of a trial lawyer, because to have said all of that with a straight face, brother, I commend you.
Thank you very much.
Look, I get it. I get what the line is. That's not reality. I mean, I worked for the Central Intelligence Agency for years. We brought people into this country as refugees, folks that had risked their lives for us abroad, who were risking arrest and torture. I'm not saying we should never admit refugees. What I'm saying is we have taken that tiny opening, that loophole, that exception that was designed, as we all know, to allow the entry of a really relatively limited number of people. And now, in effect, we're allowing virtually everyone to claim that status. And then we just let them loose into, well, we don't let them loose in the interior. We actually move them into the interior. Don't technically tell them they're legal now. We give them that notice for a hearing. But literally, in some cases, that hearing date is being scheduled 1 decade from now. And the idea that there's some federal agency out there tracking what are now millions and millions and millions of people and keeping track of their whereabouts, I mean, that's just ludicrous. I'm sorry, that's not happening. By the way, you turned this loose. Well, you didn't turn the guy loose. Again, you put him on a plane and you flew him to New York, and then they're housing him. And now he's got a hearing date 5, 6, 10 years from now. He's got to feed himself in the interim. And if we're not going to feed him and house him and clothe his kids, et cetera, for the next decade, then obviously anybody with any common sense knows that no matter what his status is, he's going to go get a job. So, which he's going to take from somebody who's here legally. In fact, one of the big complaints now in New York is that illegals who have been here for a long time are losing their jobs to the more recent illegals who are even more desperate. So they're taking their jobs and now they're unemployed. That, I mean, again, we have taken something that was constructed, was supposed to be a narrow, not exception is probably the wrong word. We were talking about a very limited number of people, and we've just blown it out of proportion. Almost nobody actually gets put back across the border. In fact, on most days, Border Patrol is so busy processing illegals and the paperwork that in many sectors, there's nobody left on the border. And as we all know, one of the many impacts of that is the narco cartels deliberately, because they, at this point, make more money moving people than drugs, they shove people across that border knowing that all the Border Patrol guys will have to go process them. And then they have a free hand to move, I don't know, fentanyl, which is killing 100,000 Americans a year. I mean, the bottom line is we don't control the border anymore. The border is a fiction.
So what are your thoughts about the standoff in Texas?
Well, right now we have an order from the Supreme Court. That's the point, right? The Supreme Court is saying, no, you know what? Now the federal agents have the right to cut this barbed wire because it's inhumane. It violates all international human rights. It's cruel. It's inhumane. And now Texas is saying we're going to continue to do it. Who are they helping? Who is their target? What are they trying to do? Protect the American people by having something harmful, something risky for people crossing the border? How are they helping the American people?
I'll tell you who they're protecting. The people who pay taxes every day for the services that they're not getting. Have you ever thought about that?
Yes, that's 100%.
Other than the immigrants?
100%.
Maybe that's what they're protecting.
But I don't see the trade-off between paying taxes and having mothers and children die at the border because somebody wanted to put barbed wire.
Because you don't want to see it. That's why you don't see it. You see whatever you want to see as a lawyer. You do a very good job.
I disagree. Money can be replaced.
Disagree.
Money can be replaced. The life of a child cannot.
You're playing on our emotions now. We're over that. We've heard that before.
All politicians playing on emotion, saying that they're getting invaded. Now there's fentanyl related to immigrants.
I haven't heard one argument for you.
There's no connection.
Considering the American people. Not one argument. Your only argument about the invaders coming across the border. Not one argument about the sympathy and what is impacting their everyday Americans' life. Not
yes,
once.
There is.
Have you mustered 1 ounce of sweat to talk about that?
My argument is the same argument that I have for myself. Choose your leaders. Go to vote. Listen to your leaders, and your candidates should know the American
Well, they
people.
chose Abbott, and he's decided. So I agree with you. Choose your leaders and follow your leaders.
Exactly.
And that's what they're doing. Sam, talk about the border. What's going on in Texas?
Look, for a long time when we've been talking about the border or the Biden administration more generally, we've been throwing around the idea of a constitutional crisis. Sooner or later, this administration that just kind of decides to act as if we live in a monarchy is going to provoke a constitutional crisis. Well, we have one. I mean, they're in a complete standoff with Texas. The Supreme Court, I mean, the legal aspects of this get kind of complicated in terms of what the Supreme Court was obviously exactly ruling on, and they didn't conduct a full-blown trial, et cetera. But the Supreme Court ruled that the Border Patrol must be allowed access to cut the wire and access to the border, cut the wire that Texas has put up. Texas is putting up more wire, and Texas is putting up more barriers, and Texas isn't backing down. The other thing that just happened is the union for the Border Patrol, which is, I don't know, I want to say 14,000 guys, something like that. The union that represents the Border Patrol officers just came out with a lengthy statement. If you read it, it's pretty hard hitting. And what it says basically is we stand with Texas. There's no fight between us and Texas.
And also, let me interject, 26 governors from other states that sent in their National Guard in solidarity with Texas.
Yeah, that's right. You got more than half the governors in the country. And now you got the Border Patrol. In fact, there's a line in there, I won't be able to quote it exactly in the statement from the Border Patrol, which says something to the effect of, the Border Patrol will always follow lawful orders, but every document signed by, I think their verbiage is, an outhouse lawyer doesn't constitute a lawful order. Now, if you read into that, I think what you can hear is the Border Patrol saying, at some point in the very near future, we may very well tell you, federal government, we will not follow that order because it is not lawful and it is not constitutional. That's where we are. That's how stressed the system is. We're on the brink of the federal government fracturing over this.
And listen, Biden's not going to push for that to be enforced. He's too afraid it's a political year. And Texans are not going to fight each other. They stand in solidarity together because you know what they're doing now? They're putting Americans always and not last.
And I support that. I support 100% that Americans are the primarily reason why we have the laws in America. But at the same time, we should not have inhumane, risky measures. There is a system to do it. Does Texas wants a better border patrol, a better border system? Then take it to your congressman, take it to your president. Do not take laws or actions on your own hands. Shooting people at the border and putting them barbed wire at the border is not the answer. America is not that. America is not Texas putting risk or putting mini, bombs at the border for the immigrants. That's not America.
Bombs, shooting? I've not read that.
That's next.
Oh, well, you make it sound as though it's happening now. So you're projecting.
Self-defense.
Let's be clear. Let's be clear on what you're saying. What you're saying has not happened. Well, please, come on now.
At the same time,
come on. Let's not do the propaganda. Not here.
It's not an invasion. It's not an invasion.
That has not happened.
It's not an invasion.
I want everybody to understand there's been no shooting, no bombs. This is propaganda. But please continue.
At the same time, there's no invasion. There is a system.
Oh, there's an invasion.
People are going to court. I'm sorry, sir, but your other guest mentioned that it's taking 10 years. No, it's not taking 10 years. Our clients are going to court a year from today. And if they don't prove their case, they get deported. There are a lot of people get deported. There's on the news, I don't have to say it. You can just watch the news. People are being sent back to their countries in a plane, in a humane way. There's a system of laws. There's a legal system. The American legal system is the best one in the world. Why not follow it?
Yeah, because everybody can exploit it. Because nobody can invade somebody else's country and get away with it like coming to the United States. That's why you love the American legal system. What legal system? You mean it's the legal system?
It's called the American legal system, not the Texas legal system where they can do what they want.
Sam?
Yeah, well, I mean... Look, this whole business about razor wire and people getting hurt and so forth is just kind of boggles my mind. As you said, nobody's getting shot, nobody's getting blown up. If you string razor wire, it's a barrier. It's commonly done. I can see it around used car lots in the United States. Doesn't hurt anybody unless you start climbing over top of it and trying to penetrate the place that's closed off. And this basic idea that we don't have any right to control access to the country is crazy, right? I mean, the people that do that don't go to bed at night with their front door to their house wide open and just accept anybody can walk in. I mean, these are really basic fundamental concepts. Again, let's just be honest. The ideology behind the Biden administration's policy is open borders. They don't want to say it out loud because they know the American people don't support it. So they cover it in different ways. But that, in effect, de facto, in reality, that's what we're doing right now. Nobody changed the law. Nobody passed a new act. Nobody said the American people certainly don't want it. But the Biden administration has decided to implement it anyway.
You have the last word.
To me, that sounds like propaganda. There's no open borders, sir, because if there was open borders,
they're not open borders.
My job will be just getting them papers.
Are you sitting here on this show tonight telling us they're not open borders?
And I'll tell you why. I go to court to fight a case. If my job wasn't going to court to fight a case, then I would agree with you. If it was open borders, I will be signing green cards. But I'm not. I'm going to court because the U.S. government is trying to deport these people. If we had open borders, my job will be a lot easier, and it's not. I work 7 days a week in court fighting for these immigrants. There's no open borders. Yes, there's a faulty immigration system. I agree. We need better immigration reform. I agree. But we need that from our leaders. The immigrants are not to blame.
Is the president one of our leaders?
Of course.
Is he providing that leadership in that example?
Clearly not, and we'll see in the polls.
Yes. Well, we agree. Thank you.
Finally.
So much. Finally, we agree.
Yes.
Sam, also thank you for joining us. When we come back, Gene Drummond, Dr. Bryan Donohue will join us to talk about the healthcare and Medicare landscape here in America. Don't go away. Your voice, your future.
It is easier to build up strong children than to try and repair broken men.
The streets are plagued with crime, violence. There's a lot of poverty, and it's all a result of lack of education that's happening in our schools. So it really is a crisis.
We come from very different political perspectives, but we've come to the same conclusion, and that is there is a crisis in the classroom. Children are being deprived of quality of life because they're being deprived of a good education. We must solve this problem. It's incumbent upon all of us to join hands together to get this done.
We can't afford to wait one more day before we address these issues, because every day we lose another child.
Let's stop the politicking. Let's stop the games. Let's really do something to give these kids a real chance at life and being a part of that American dream.
We need accountability for funding. Many of the districts where you're seeing very low test scores, students graduating with very low literacy and math comprehension rates, they are receiving a lot of funding. So where is the money going where our kids aren't being adequately educated?
If you believe every child is deserving of a quality education, please go to educationjusticefoundation.com.
And welcome back to Your Voice, Your Future. I'm your moderator, Armstrong Williams. You know, people often talk about businesses that are closing all across the United States. But one of the things that we don't talk about enough is what happened when there are hospital closures. And that happens, Dr. Donohue. Welcome to the broadcast.
Well, Armstrong, as always, it's a great pleasure, particularly here in the studio. You're so right. And your last segment begs that question. So it isn't the case that we're a nation of men or women. We're a nation of laws. And it's been my experience over the years that in general, when something starts off bad, it gets worse. Rarely does it start off bad and go good. So if we begin our relationship by breaking the law, it has consequences down the road. The healthcare system is overwhelmed by this. I would suggest that any of your viewers who don't think this is the case, swing by any urban emergency room anytime and ask yourself, is this staff strained to the limit? Is our healthcare system overwhelmed? Are people crossing the border illegally, getting screened for diseases? Could some of those diseases be communicable? Here we are, just now in the wake of COVID, and glibly overlooking the fact that we don't have a border, and forgetting just for a moment that no nation in the history of mankind has survived without a border. You know, I have 6 kids at home. My job last night was to go around and check the doors to make sure the doors are locked. It doesn't make me anti-homeless. It just means I need to secure the well-being of my family, and so it is with the nation. And the one thing, Armstrong, all of our viewers, I think, can agree on is the single purpose of government that is beyond dispute is to maintain the safety of the governed. And that means, of course, assessing who it is that becomes citizens in the United States and protecting us from what we now have, which is an absolute over-the-transom invasion.
You know, Gene Drummond, there is a healthcare staffing crisis. And you know what? People are finding a hard time to find a good doctor. You know, I'm fortunate. I've had the same doctor for the last 35 years without any interruption. But talk about the staffing crisis and the larger impact that it has, and just people finding good physicians.
Yeah, absolutely. Well, first of all, thank you so much, Armstrong. I'm always pleased. So, as you know, we've been in business with Healthcare Dynamics International for now. Actually, we'll be celebrating 33 years very soon. And it's no question, since when COVID came, there was just such a challenge with our healthcare workers. I mean, the entire system was stretched. It was something we had never seen. But I'm going to say particularly in our line of work, when we think about health disparities and health equity, and when we look at our communities, the zip codes, the disadvantaged communities, particularly these are communities that are healthcare shortage areas, which, you know, certainly some of the Department of Health and Human Services agencies like HRSA really focus on trying to increase the number of particularly minorities that enter into healthcare. Why? Because we know that there is something called physician concordance, and we know that when you have a lived experience, maybe coming from, you know, a community that was disadvantaged, you tend to want to serve. I know I'm a PA. My husband's a physician. Both of us came from communities that, you know, were disadvantaged, were lower socioeconomic areas, and so we want to give back to those communities. So yes, it is a decline, but there are programs and strategies. In fact, we're working with one, I'm happy to say, with the HBCU Bowie, that we're trying to increase the number of public health, information, technology students that are interested in the data analytics to understand health equity and how we can develop more culturally competent, culturally intelligent programs so that we can go out into the communities, so that we can serve minority populations that may be living in zip codes that have under-resourced medical professionals. So indeed it is, but there are strategies going on that you don't have to. How long does it take to get a doctor? Like 20, 30 years, right? I'm a PA. I'm a physician assistant. My education was much shorter, although PAs are excellent in primary care. Nurse practitioners are. We have community health workers. Oh, what an amazing opportunity, because they still are individuals from those communities. We can hire them. Economics, come on, right? Economics. They know the cultural nuances of their community. They have the voice, trusted voice. And so I'm excited. HCDI, we employ so many community health workers across the country to be able to serve the local needs. And those local needs are social needs, healthcare needs. You can teach them about hypertension, cardiology, to my cardiologist here. And so, yes, there is a problem, but we bring in solutions to it, because that's what we need is innovators, disruptive thinkers of how we can address these issues related to health equity.
You know, Dr. Michael Knight from George Washington University is also joining us. How do we deal with these preventable medical errors that continue to occur and cost people their lives and serious medical consequences?
Yeah, thank you for that question, Armstrong. You know, what we have to realize is that there will always be errors when it comes to human, right? There's always going to be human error. So it's about building systems that will prevent human error from reaching the patient. As someone who spent many years as a patient safety officer, there's a whole patient safety science that is designed to have checks and balances, whether it's in the electronic medical record. Anyone who's been to a hospital, you probably know that there's a wristband that has your name. It may even have a QR code that the nurse may scan to confirm that you are the right patient to receive the right medication. These are systems that are put in place to keep patients safe. Now, what happens when we ignore systems or when we're understaffed? When our nurses, our physicians are doing much, much more than they may be capable of doing because of the hours they've been working or the volume of work that they are doing, people get tired, people get fatigued. And then that's when we start seeing mistakes happening. So it's really not only building systems to prevent human error, which is going to happen from reaching patients, but also ensuring that we have a strong healthcare system and that our healthcare providers and staff feel empowered and also feel like the health system in general, the healthcare organization that they're working for, is keeping in mind their well-being and vitality. And if I've been working for over 24 hours and I'm tired and I have an additional 10, 12, 15 patients to see, and do I feel empowered to say, I'm not feeling so well, I'm feeling tired, I feel like I could make a mistake? We have to have that real conversation. We wouldn't want a pilot flying our plane who doesn't feel up to it. And we have to have that conversation with healthcare staff. And of course, we want to give them resources so that they always feel up to it, because we need them. We need physicians, we need nurses, we need all healthcare professionals to be on target and ready to deliver the healthcare that our community needs.
Dr. Donohue, which brings us to, what about this poor, amenable mortality rate?
So, Armstrong, our nation does not lead the world in healthcare outcomes. So it is the case that infant mortality in America is something that lags behind most of the countries in Europe, lots of the countries in Asia, and it's multifactorial. But on the other hand, in general, it is the case that the future of healthcare is determined here in America. Ask yourself what drugs your physician that you described over the last 30 years prescribed for you that came from Finland or Russia. So the first thing I have to say is that American healthcare is the envy of the world. And in full disclosure, needless to say, mistakes are made, needless to say there's room to improve. Deaths of despair in America lead the world by 5-fold. It's a staggering fact. Yes, infant mortality, and as Jean has suggested, there are pockets where infant mortality is a far bigger issue than it is in other areas. Infant mortality is something that I think is among our easiest things to fix, because principally infant mortality is a matter of access. It isn't a fundamental thing that we need to understand in new ways. We just need to build a pipe to bring the water from the reservoir to a thirsty population. And that's always an easier thing to do, and we've been good at that over the years. But it is the case that we in America should be the shining city on a hill, and in lots of areas of healthcare, Armstrong, we are not.
So, please, go ahead.
Yeah, absolutely. So thank you, Doc, for saying that. One of the things that I just think is almost an atrocity is our maternal mortality and morbidity specifically related to brown and black moms. When you look at the data and you just kind of see, there's some reports that are out that just make you, I mean, why are our black moms, and these are many times black moms who are well educated. I mean, the history is just there. And so I think it's.
So what is the reason?
Well, let's look at implicit bias. implicit bias. Is it really true? Of course not, that black women can sustain a higher level of pain than others, or that they're just not taken serious when they're, when they're sharing something's not right. I mean, when you look at the data.
Not taken serious by whom?
Not taken serious by maybe their healthcare providers. So when you look at the data around outcomes for more women that have had just post-pregnancy, that have just had their postpartum, and it's. So
you think race plays an issue in this?
I think that implicit bias. I think that just historically, we have a real need to make sure that individuals are aware of their their biases, and and are aware of that when they're treating their patients. But yes, and so as the doctor.
Why would race matter when you're treating a patient, Dr. Donohue?
Yeah.
I'm missing something here.
No. So whether you have access, he mentioned the access, and just your
Wait a minute. Whoa. Why would it matter?
Why would race matter?
Yeah.
So it is not, in my experience, having been deeply immersed in the healthcare system for 35 years, that any physician that I've ever had contact with undertakes healthcare in a fashion that is somehow dependent on your race or your gender or your other obvious demographics. Principally, in my experience, these disparities relate to access issues. And so and it isn't just infant mortality. For example, we talked about this previously.
Just hold on, let me go to a break. Let me go to a break, because I got to have this conversation, because I don't want nobody to have no excuse as to why they don't go see the doctor and why they don't have access, because everybody needs to go see their doctor. Now, I know a lot of men don't want to go because they're afraid of what the results might be. That's their issue, but that's the choice they make. Your Voice, Your Future. We'll be back.
As a home buyer, you need a lender who cares about your home ownership dreams. United Security Financial has been helping families secure their dream homes for 30 years. We're a national fair practice lender that provides affordable mortgages and low down payment programs to eligible home buyers. To learn how United Security Financial can help you secure your dream home, call 1-800-373-4186.
Let me go to Dr. Knight. Are you concerned about the quality of health care in this country?
I'm extremely concerned. And to pick up for our last conversation, I think we really have to look at the data, okay? We know that race is a social construct. Genetically, we're 99.9% the same. So when we see certain groups of individuals that have worse health outcomes almost across the board. So let's talk about Maryland, for example, whether it is health disparities around heart disease, prostate cancer, breast cancer, maternal mortality was identified. Why would one group have the highest levels across the board? We know that it's multifactorial. We talked about access, we talked about socioeconomics, but as one of the guests outlined, I think we also have to think about how people are received, how people may be treated in different settings. If anyone has walked into a private hospital, a private setting, versus a public institution where there is overcrowding, where there is limited time with providers, the experience is very different. And unfortunately, there are communities that's the go-to, and the experience has not been there. And those who want to know, it's been published many, many times. Individuals are oftentimes told different things or a level of detail about very similar conditions. When we think about things that are subjective, if you come to me and say, something feels wrong with this pregnancy, or I'm in pain, I'm not fully having my pain being controlled by this medication, I as a healthcare provider have to make a determination. There's no objective evidence. And if there's implicit bias, or if there's a way that I view someone, or I'm just tired, or the time, or the way that I think about supporting someone, it can be affected. So I agree with Dr. Donohue. I don't think we have healthcare professionals who go into medicine, go into healthcare to treat people different. But the reality is, it's not the same experience for everyone, and we want to get to the place where it is.
Absolutely.
So let me raise this, because I mentioned this in the introduction. of the show. When is it that a person must come to the realization they need to go see a doctor? They may be sick. There may be things that are going on with their body that has changed. They may be dying. We have so many young people today just dropping dead. Just unprecedented. And I say to myself, when I read these stories, there had to have been some symptoms that they ignored. They just thought it was something, and then it continued to build, and all of a sudden, they collapse. Yeah. What has changed in our environment, Dr. Donohue, that people need to pay much closer attention to?
Well, the first issue that you raise, Armstrong, is that unfortunately, the devil doesn't always spend money on advertising. So we have 375,000 people a year in America who have out-of-hospital sudden death. They weren't uninformed. They didn't have symptoms. They presented as the initial expression of vascular disease with sudden cardiac death. Just over the tenure of my career, essentially every aspect of vascular mortality has been addressed except that. So the same number keeps staring off the page year after year. So it is the case that oftentimes illness presents in a fashion that is an advanced or even end-of-life moment without a long prologue. All of your viewers tonight can think of members of their family or friends who have had the presentation of malignancy in an advanced stage. So it is the case that oftentimes serious illness or even life-threatening illness doesn't make itself evident. So we're used to thinking in our own experience about, say, getting the flu and you have a little sore throat today and a headache tomorrow, and then the third day you feel poorly. So we're used to that kind of prologue. But in more insidious disease and more life-threatening disease, that is not always the case. Turns out, for example, that for the average American, it takes 6 hours of continuous chest pain before that individual goes to the hospital. Think about that. It takes the average physician, the most well-educated cohort on earth, about 3 hours. So we're all doing something else, and it's kind of an after-the-fact moment that we look at this and see it in retrospect. But life unfolds from now to the future, not backwards, and so very often we miss illness, and as you say, and very often illness, even severe illness, presents with very mild symptoms. For example, in the Framingham study, it turned out that 25% of all people who had heart attacks had either no symptoms or symptoms that neither they nor their attending physician recognized. So this isn't some kind of failure of the healthcare system. This is the nature of serious disease. It isn't always so easy. There isn't always breastfeeding and hand waving. Sometimes these things creep in insidiously and only present when the snake is about to bite.
So, you know, I love the clinical, perspective that you have there. So I'm going to bring you to something that we call now the social determinants of health. Or we're finding so many, when we look at disparities and when we look at just particular racial and ethnic populations, when we see the disproportionate level of disparities and outcomes in these particular populations. I want to go back just real quickly, just one of the data points to share with you, particularly in Black women in the United States have almost 70% of maternal mortality rate to their counterparts, their Caucasian counterparts, of 3 times more. That's 3 times the rate of white women. And this is according to the CDC. So what are some of the drivers of that? Well, why don't we go to the doctor? We may not have, first of all, access, and access takes multiple layers. Do you not have health insurance? Do you not have transportation? You might have transportation, but if you've got 3 or 4 children, you may have to go across town to 3 or 4 different places. You may not have literacy. You may not have a job. You may have a job with you may be an essential worker on a job and you don't have access to health insurance. Or you may have health insurance, but you don't have money for pharmacy, right? And we know even here in Baltimore, the pharmacy deserts are just expanding. What is a pharmacy desert? Clearly a place where medications for that community, there's no pharmacy, and even more so, there may be a pharmacy there, but the medications, that pharmacy may not stock the medications that are needed, such as hypertensive medications. And so there's so many issues. Yes, there's access, but when you think about the social, the construct that oftentimes lower income populations live in. The stress of is a gunshot, happening. Do I have food? I may be a diabetic, a person with diabetes. Do I have access to food? Well, hold on, I've got access to the 7-Eleven there that has high salt content food. Right, so it's so much broader than just our physical, it's so much that leads to that drives to the challenges that we have. And so I'm really excited that our healthcare system now, CMS, is really speaking of this we're looking at race and ethnicity and how it plays, making sure that providers are seeing that we've got to look at these social determinants of health, because it is having such an impact on an individual's ability to take care of their conditions.
So, Dr. Knight, I often say I haven't taken medicine in 36 years. I'm out 4 a.m. in the morning in the cold running 6 miles. It's not easy. I don't think we place enough emphasis on what the individual could also do in this process of better taking care of their health. And some people say, well, I don't want to run, but you can get out of bed and you can just jump rope, or you can just jump up in one spot, you can do all kinds of things by yourself in the room. Why is it that people don't understand the importance of exercise, of heating your body, warming it in the morning, whether it's in the cold or inside the room, how that also is a very important preventative measure?
That's a great point, Armstrong. When I was growing up, we had physical education class. And as an elementary school student, as a young child, I learned the benefits of exercise and health. The reality is our children today do not all have that opportunity. There have been numerous counties that have cut funding for physical education, for health education in our schools. And you'll say, why am I talking about schools? Because knowing what healthy behaviors are critical piece of knowledge that we need our children and every human to know. So just like I need to teach my child how to manage their money, brush your teeth, tie your shoelace, knowing the healthy behaviors are so critical. And you may think, oh, everyone knows. You don't. I have patients that come to me that could not identify what sodium is, or even know how to identify that this is a high salt meal. I'll say to them, your cholesterol is through the roof. They say, well, I'm not eating cakes and cookies. And I say, well, there's a lot of cholesterol in the meat that was fried that you had last night. But they don't even know that because the education is not happening in the school system anymore. When it comes to the types of food we eat, the physical activity, preventive health is where it is. And as you've outlined, Armstrong, I want my patients not to be on medication. I am so excited when I see my 60-year-olds, my 65-year-olds coming in with a clean bill of health, because we're focused on prevention. But we can't assume everyone knows it. We got to be teaching each other. And the health education, as Gene Drummond, who was my colleague from many years ago, outlined, community health workers are people that are doing that every day.
I cannot thank you and Gunther and Sam Faddis and all of us for joining us for this edition of Your Voice, Your Future. Yes, we're out of time, but the conversation should continue where you are.